There are situations in life when things we do every day, without thinking too much about it, can suddenly turn into nightmarish moments. Well, one of those times is when we have pain when we urinate. Those who have already suffered from it know it well and can describe it as a sensation of pain mixed with a very slow urine output, often drop by drop. This is Stranguria, for example, pain while urinating mixed with slow urination. We will now see what causes this problem and what we should do if it occurs to us or one of our acquaintances. Hello and welcome back to Med4Care. I am Dr. Care and today we are dealing with painful urination, or Stranguria. What is Stranguria? It is a diuresis disorder in which urine is emitted in minute volumes or drops, accompanied by excruciating pain in the lower abdomen, like the area above the pubis. The emission of drip urine occurs simultaneously with pain while urinating, often due to an obstruction, but not only. There are many possible causes and obstruction is only one of them. Stranguria is in fact a typical symptom of many different urinary tract problems, both irritative and obstructive in nature. Urinary tract infection can affect the entire urinary tract indiscriminately, from top to bottom, for example. It can affect the kidneys, generating an infection called pyelonephritis. The ducts that carry urine from the kidney to the bladder, called ureters, the inflammation or infection of which is called ureteritis. The bladder, leading to cystitis. The duct that carries urine from the bladder to the outside, called the urethra, which determines urethritis. In men, an infection of a structure around the urethra, the prostate, can also be determined, leading to prostatitis. In most cases, urinary tract infections are sustained by the action of a single microorganism, the bacterium Escherichia coli. As a rule, this bacterium is present in the intestine and can change location by moving up the urinary tract if it finds favorable conditions. This bacterium is able to induce the release of substances responsible for the perception of pain felt before or during urination. Most urinary tract infections occur in the bladder, resulting in cystitis, which can also appear in other forms with different mechanisms of onset, such as interstitial cystitis, actinic cystitis caused by radiotherapy, and cystitis caused by the persistent use of certain drugs. Non-infectious inflammatory causes. Inflammatory conditions may sometimes not be due to infection. The best-known case is urinary calculosis, which consists of the formation of a stone that often lodges or gets stuck in the kidney, ureter, bladder, or urethra. In these cases, the pain is due to the contraction, like a spasm, of the affected muscles. Other rare cases of inflammation without infection are cancerous conditions. Many conditions can generate a transient or permanent obstruction anywhere in the urinary tract, triggering urine stagnation and a subsequent inflammatory and, later, infectious reaction. We have already talked about urinary stones when we mentioned inflammatory causes. In addition to producing inflammation in the kidney or bladder, kidney stones can also, in some cases, lead to obstruction in the smaller channels where urine flows, preventing its outflow. This occurs in the ureters and urethra. In men of a certain age there may be benign prostatic hyperplasia which, as it bulges, squeezes the urine channel, the urethra, and thus tends to reduce the outflow of urine. In women, however, it is easier to encounter bladder neck disease or urethral stenosis as causes of obstruction. Generally, bladder pain associated with slow diuresis is accompanied by other inflammatory urinary symptoms. Let's look at them together. Bladder tenesmus, which is the sensation of an urgent need to urinate accompanied by pain above the pubis, due to spasm of the bladder muscles. Then there is Nocturia, with frequent emission of urine during the night, which we have already discussed in another video. There can also be the emission of small and frequent volumes of urine, in technical jargon called Pollakiuria, to which we have already dedicated another video. And finally, urinary urgency, or the urgent desire to urinate. Similarly, strangury may be associated with symptoms of an obstructive nature, such as post-terminal drip or terminal drip, which involves the emission of droplet urine after the end of urination. The hypovalid micturition, with poor or intermittent urinary flow. There may also be micturition hesitation, with delay in starting urination. Finally, the sensation of incomplete bladder emptying when you feel that part of the urine remains retained in the bladder is also part of the associated symptoms. If it is the first time urinary pain appears, it is advisable to consult your doctor or a urologist specialist. At the time of the examination, the doctor assesses information about general health and whether there are any acute or chronic diseases in progress, whether treated or not by medication. Next, the doctor attempts to identify the cause of the strangury, for instance by tracing it back to an ongoing urinary tract infection, discovering, for instance, that the patient has had febrile episodes recently. The doctor continues the examination with an objective examination, inspecting and palpating the lower abdominal region and the pelvic region, looking for swellings and areas of tenderness. At the end of the examination, the doctor prescribes various examinations for the patient, including laboratory tests. The most useful laboratory tests to better understand the origin of urinary pain are blood tests, with particular reference to the leukocyte formula, which makes it possible to identify an increase in white blood cells in the blood, for example, which is an indicator of an ongoing infection. Urine examination, with special regard to the presence of white blood cells in small quantities, leukocyturia. White blood cells in large quantities, which is termed pyuria. Blood in the sample, termed hematuria. If the examinations lead to the suspicion of a urinary infection, then another urine test can be performed, looking for the bacteria responsible for the infection. This test is called urine culture. Urine is normally sterile and does not contain any bacteria. Therefore, urine samples are placed inside plates where there is a good medium for the bacteria to grow, and if they are present inside the urine, they will multiply by invading the whole plate and showing their presence. In addition, antibiotics can be placed on the bacteria-rich plates to check which of them the bacteria are sensitive to. This latter analysis is called an antibiogram. If, on the other hand, the doctor during the examination is more oriented towards the suspicion of an obstructive cause, then the most suitable examinations are an ultrasound of the renal excretory tract, evaluating the kidney and bladder, in search of mechanical obstructions, as is the case with calculi, or a transrectal ultrasound, particularly for men, to better assess the size of the prostate. Based on the result of the examination, objective examination, blood tests and instrumental examinations, the doctor formulates the diagnosis, which will be oriented more towards an infectious/inflammatory fact or an obstructive cause. If it is an infection, an antibiotic will be prescribed, if possible according to the results of the antibiogram. In the case of an obstruction of the urinary tract, the urologist will consider whether to remove a urinary stone with an endoscopic procedure, with shock waves, or simply to reduce urinary pain with medication, pending spontaneous expulsion. If, on the other hand, the obstruction is caused by an enlarged or inflamed prostate, treatment will be directed towards reducing the prostate volume with drugs or a surgical approach. We have now come to the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video comes out on Med4Care. See you soon!